Hey guys, I've talked about dental implants before, where you literally screw an implant or a titanium screw into someone's jaw to replace a tooth. Now this is becoming a very common procedure, but I thought I'd show you exactly what it looks like from start to finish to actually place an implant. Now disclaimer, this is actually showing a surgery, so you will see blood, you will see the gums being opened, so if this is not something that you want to see, then stop watching this video now, please. I don't want to hear you yelling at me in the comment section later. Well, I guess I probably won't hear you yelling, I'll probably just see you yelling in the comments, but who cares? So this is a video that I found that was pretty much spot on how a dental implant is actually done in an office.
Hi there, I want to welcome everybody back for another case of the week here on Chairside Live.
Okay, so they're starting off by just showing pictures and an x-ray of the area that we're working on. And you can see that x-ray in that picture that there is a missing tooth. And the goal is to basically put a new tooth magically there. And you can also see on that x-ray that that back tooth started drifting forward. It's not like perfectly upright like that tooth in the front. And that's because when you have a missing tooth, after some time, those teeth that are neighboring that missing spot try to kind of close in and fill in that missing space. So that's normal for that tooth in the back to kind of drift forward like this. Now, luckily in this case, we still have enough room to place a new tooth, but had that tooth be totally upright, you could probably fit a normal or a bigger size tooth there.
Obviously, I've done this in the past where I've presented.
So first he's putting this numbing jelly so that when they actually put the numbing needle, you won't actually feel it. And now he's putting that numbing needle, which is gonna basically make it so you don't feel anything during this procedure. And he's gonna numb all the gums in that area just to make sure that everything is gonna be comfortable for the patient. And that's another important thing that he didn't really show is he took a CT or a CBCT, which is a 3D scan. So that x-ray that you saw was a 2D image, but you don't see like the depth or the width of the bone. But when you're doing an implant, you wanna make sure that you get all the measurements right, so you know exactly what size implant you can place. So all these measurements he had done before. So it's not like he's just winging where he's gonna put this implant. He knows exactly where he's gonna place it so that he doesn't hurt anything and make sure that he doesn't hit the nerve, for example, or make sure that he doesn't go too big or too small.
This area, the CT scans are very.
And now after you get numb, it's on to the fun stuff.
For practice, and it's a good tool to have.
So now he's actually making an incision into the gums, and then he's gonna pull those gums back so he can actually see the bone.
The treatment, what I usually like to do is reflect the full thickness flap.
So he's using this instrument to basically pull those gums back, and eventually you're gonna see the bone.
The buccal of the tooth, or the area that you're placing the implant, and you could design it so that you can create a little bit more keratin.
I'm gonna fast forward a little bit so that we could skip that. Now you can see that you can clearly see all the bone there.
Soft tissue, and then I'll start with my start drill. Usually what I like to do is...
And now he's gonna actually start drilling into the bone. So the way he does is he basically starts taking like a small drill, drills a little bit, and then he's gonna take an x-ray. That x-ray is basically to show like a check to see if I'm drilling in the right spot, to see so far if I put an implant here, is it going to be in the right location? Because if something seems off, you can still fix it with the later drills. You see, the way this works is you basically take a series of drills from like small to bigger, and they all have their own sizing until you're ready to place the implant. You can also see that white strand that he put over that post. That is basically a piece of floss. So he tied a piece of floss, and the reason he did that is because in case the patient swallows or inhales that, he can quickly pull it out so that patient doesn't choke on it.
And place it into the osteotomy site and take a radiograph. This will kind of help me gauge the direction of this implant and whether I'm going in the right direction or not. Both visually, I can look at it.
So you can see that x-ray so far it looks pretty good. It might look like he's closer to that front tooth, but that's because that back tooth has started drifting more forward.
This parallel pin is coming out exactly where I want my screw access hole if I'm placing a screw retain final restoration.
And now he's going on to his next series of drills, and you can see he's spraying a lot of water, and usually what we use is something called sterile saline. And the reason you have to spray so much irrigant when you're doing this is because you want to keep that bone cool. You don't want to overheat the bone. Because what the studies show is if you don't use enough of this irrigant and that bone starts to overheat, once that implant is placed, you can start to get bone loss, or that bone will start to pull away, and the implant won't last as long.
So in this case, I move to the next osteotomy.
So he's basically just going on to the next drill, and then he's just going to keep doing this and keep checking as he goes.
It's important to use irrigation when you're using the shaping drills so that you don't cause any necrosis of the bone. The RPM I use is between 800 to 1200 RPM.
So the 800 to 1200 RPM is basically the rotations per minute. Now, depending on the implant system you're using or the different drills that you're using, they might have different specifications. So some drills might go a little bit slower, some drills you might want to go faster.
And I'll go slowly and create my osteotomy in order for the area to receive the implant. Now what I do is, as I move up in size with the shaping drills, I want to use my parallel pin.
So again, he's going to take another x-ray because he went to a bigger size, and he went a little bit deeper, and now it looks a little bit off. And you can see that pin is kind of tilted back. It's kind of in a weird direction. If you were to keep going, he might even touch that root in front of that pin. So it's a good thing he actually checked it here, because you don't want to keep going in this angulation. And luckily, at this point, he can probably still kind of correct it. And the way you would do that is literally when you're drilling is just kind of move the position of your wrist to kind of make that implant more upright. A lot of times when you're drilling into that bone, it can look like you're going in the right spot, but you're actually not. And that's why we take the x-ray.
The next shaping drill to upright the area and make sure that...
And now that's exactly what he's doing. He's taking his next drill and he's actually going to try to upright it by moving his wrist in a different direction to basically get that implant more exactly where he wants it.
Then I can move forward and place my implant. So there you have a view of where the osteotomy is.
So that's basically the osteotomy, or the hole that he created in the bone.
And driver onto the torque wrench.
And now he's going to actually place the implant. So it's kind of like if you were to screw something in a piece of wood, you just have to make like a pilot hole, and then you can screw that screw in. That's exactly what you're doing, but in the bone.
To the osteotomy site. And I'll start to...
So right now he's screwing in that implant with like a torque wrench, which is literally like a manual thing that you just keep torquing and turning.
The handpiece and the handpiece.
And that torque wrench actually has a setting, so it won't go too tight. Because when you're putting the implant in the bone, you don't want it to be too loose, and you don't want it to be too tight. And this is actually measured in newtons centimeters. And like he was saying, you can also do this with a handpiece, where you just put that implant into the handpiece, and you just slowly drill that implant into that right spot. And even the handpiece has a torque setting, so it won't go past a certain torque. Now, sometimes what people do is they start with the handpiece, they take the handpiece out, and then they finish off with that little torque wrench to do the final like torque of the implant into the bone.
And I feel confident with the torque wrench in this situation, and that's what I used. And this implant is a bone level implant, so it's designed to be placed at the level of the bone.
So you're saying it's a bone level implant. Essentially that means that you stop placing the implant right at the level of the bone. And that looks really good.
A one-stage procedure where I want to use a healing abutment.
So the next thing he's going to do is put something called a healing abutment on top of that implant. The healing abutment is just like as it sounds. It's a screw that goes over that implant, and it's meant for the gums to heal around it. So that metal thing sticking out is not actually the implant, it's the healing abutment that's screwed into the implant. And then he's going to close the gums over it, and then the gums will kind of contour around that healing abutment.
Screw is on there. I'll go ahead and place a couple of interrupted sutures. In this situation, I used, again, a chromic suture.
So now he's placing his sutures. He's going to help kind of guide the gums to grow around it. And you can see there it's all closed up. And you can see that screw that's sticking out. That's not the implant again, that's the healing abutment. And then on the x-ray, you can kind of see that thing sticking out on top of it. That's the actual healing abutment.
So another case where if you're incorporating implant dentistry into your practice, this case would be ideal because there's plenty of bone interproximally, mesiodistally, buccolingually, and also the nerve is far enough away from the apex of the roots in the implant where I can feel confident that I can place that implant.
So the nerve he's talking about is something called the IAN, or the inferior alveolar nerve. And that's basically a nerve that innervates the whole lower jaw. And that travels right in that spot. So you have to be really careful, and that's why you take that 3D x-ray to see where that bone is. But luckily he said that nerve is very far away. You can't even see it on this x-ray. You can maybe see the start of it, but it's hard to tell. But that nerve is really far away, so it makes it a lot easier when you're placing this implant.
Where I can feel confident that I can place that implant without hurting the patient. So thank you for joining me for another case of the week, and hope to see you back here.
So once the implant is done and all integrated, you're probably wondering, when am I going to get my tooth that goes on top of that? Well, you typically have to wait at least 3 months because it takes time for that implant to start integrating into that bone. The implant actually has to mechanically lock into that bone. And this is really important because if you put that crown on that implant too early and you start biting and chewing your foods that you like, then that implant could fail because it's not fully integrated yet. But once that implant is fully integrated, then you can start chewing on it like a normal tooth. Now you might also wonder, how painful is this? Well, luckily during the procedure, you're numb, so you shouldn't feel anything. But a lot of times you might have some discomfort in the first week. It's normal to have some swelling or bruising because as you're opening up the gums and screwing something in there, you can get a lot of inflammation. And a lot of times it's not just the first few days, it's like days 3 through 5 where you can have a lot of that pain or that pain starts to peak. Now I will say it really just depends on the person. Some people, they might have no pain after and they feel totally fine, but some people will have a lot of that pain, and it usually is between days 3 and 5 where most of that pain kicks in. But luckily, usually over-the-counter medications or things like Motrin and Tylenol are all you need to fix the pain. Anyways, thank you guys for watching. I hope you liked that video. If you haven't already, hit that thumbs up button and subscribe to my channel below. And if you want to see more reaction style videos like this, let me know in the comment section below, and I will see you guys in the next video. Be honest, if you're a dentist, how many mistakes do you think you made in your first year out of dental school? I mean, I know I made at least 10, which is what I want to talk about in this video. Now, some of these mistakes made patients like me less. Some of them made me even like myself less. But I'll tell you what, the worst mistakes were the ones that I didn't even know were mistakes until they came back and bit me later.